The best place for a person is home.
Over the years, we have helped tens of thousands of patients for pediatric, geriatric, with their daily living needs. The goal is to keep the patients as comfortable as possible in their own home.
My life before I finally got Anchor, I was sick. I spent all my day in bed, and it became very depressing.
It was really difficult realizing that I could not help myself. And I'm a person who likes to do things. Emotionally, that can be really depressing.
And then I got Anchor. I feel a little more independence. My mind is a little clearer now that I know for 5 days a week, I have somebody there.
Knowing that somebody's really there, that cares, that's watching, I feel calmer, like I can breathe.
My daughter, they were so willing to help me out. They brought really great therapists to my house. They gave me a lot better methods, taught me that I wasn't alone. It's just nice to see that they all watch her. They want to see that she's improving. I was like, okay, I know I'm in good hands here.
In my condition, I can't do this myself. Since all my life, I raised a family and did for myself. So when I got sick, this was something I was unprepared for. And Anchor has helped me make that transition. To me, I feel like they're close to family at this point.
The things at Anchor that really stand out is the amount of different types of services that we provide.
It is extremely difficult for families to be able to receive 6 different services from 6 different agencies. Anchor is the place to be able to provide all of the services under one roof. It's funded through Medicaid, which I think is the most important thing for the families, is they don't have to worry about the bills. They don't have to worry about paying for this.
When someone is in need of home care services, they're kind of lost in a lot of ways. We're really here to kind of hold their hand throughout the very complicated and a lot of times confusing process.
We really do go above and beyond to make sure that the patients are satisfied with services. We do 3-way calls with the patients and the caregivers before we send them to work to make sure that it is a match.
They put a lot of thought into who they fit the people with, and they actually care. I want somebody that's trained, and these people are trained. And the best part is, if you're not happy with somebody, you call your coordinator, and they'll send you somebody else.
Every single day, they would be like, oh, how are we doing on an update? Have you spoken to this person yet? Have you got your evaluation? And they made me feel like they genuinely, we're concerned about my daughter getting the best services possible.
I'm extremely blessed because I'm very comfortable with my workup. Oh, she can cook. Oh, let me tell you, she know how to use the seasoning and all of that. Those little things mean a lot.
The most meaningful and fulfilling part is making a difference in someone's life. I can't cure what's happening, but if I can make you feel better and a little bit easier, then that's what it's about.
What makes me happy are those phone calls that we get, the thank yous from family. Thank you for making things a lot easier.
I think the best place for a person is to be home. I think that's my main drive working here at Anchor.
Go to Anchor. There's a lot of companies, but like I said, I've looked at them, and they're the ones I've actually found to be the most reliable.
I'm grateful for their help. It makes me feel like there is an anchor in Anchor. So I've got an anchor in Anchor.